What if there was a simple and affordable test to help you clearly see inflammation and plaque in your arteries? A test that doesn't use dyes, chemicals, radiation, or needles. And what if this test could tell you about possible heart problems before you experience other apparent symptoms? Let me show you something about your heart. Vasolabs has been delivering just such a test through physicians and clinics for years. A test with measurements absolutely essential for any thorough heart attack and stroke prevention program. The test is called Carotid Intima Media Thickness Screening, or CIMT. The intima and media are two layers in the arterial wall. CIMT measures how thick those layers are. Healthy arteries have thin, flexible walls free from obstructions that allow unrestricted blood flow. Thickened walls can lead to plaque buildup. Vasolabs CIMT screening shows you both the wall thickening as well as localized plaque buildup. To see and measure this arterial damage, ultrasound is used. The same safe and simple ultrasound used to scan expecting mothers to see and track the health of a baby. CIMT uses ultrasound to show you a real-time image of the arteries in your neck. There are two carotid arteries, one on either side of the neck. They are the major blood vessels that carry oxygen-rich blood from the heart to the brain. Research has established that whatever is in your carotid arteries will also be in your coronary arteries. Vasolabs CIMT screening shows you the health of your arteries by measuring the thickness of the intima media layers and the size and locations of plaques. CIMT also pinpoints where they are in your arteries and can provide a hint of how dangerous your arterial damage may be. Vasolabs gives you a report with these measurements. Let's take a look at a real report. The thickness of the arterial walls, CIMT, is reported here. And the size and type of the largest plaque found is reported here. Both are recorded in millimeters. The bigger the number, the thicker the walls, and the larger the plaque. Using this information and comparing it to large research studies of tens of thousands of patients, Vasolabs tells you the vascular age of your arteries. Your scores are then used to generate a comparison showing your risk for heart disease. That risk is shown as a percentile here. This section of the report shows you the health of your arteries in distinct locations. By accessing your report online, you'll be able to look at the actual images and video shown to you during your in-person screening. Just click on the thumbnail. The Vasolabs CIMT screening report shows you critical information about your arteries. It's a tracking tool you and your doctor can use to improve your health. Vasolabs CIMT screening has proven to be more effective than either CT or coronary artery calcium, CAC scans, at identifying plaque in this early phase. For years, pharmaceutical companies and healthcare providers have had access to and been able to use this information. And now, with the Vasolabs Carotid Intima Media Thickness Screening, you can have it too. With this simple, non-invasive 10-minute procedure performed in your doctor's office, you'll take a critical step for your healthier future. Even if you have no apparent symptoms of heart disease, your Vasolabs CIMT screening report can give you and your doctor the tools you need to beat the odds and create a plan for a heart-healthy life. For more information, visit vasolabs.com.